In this presentation, I will talk about the tooth fractures, which is a part of two parts of the traumatic injuries that happen to the tooth. As I have said in the previous videos, there are some factors that will lead to the most common pulpal disease or pulpitis. And these factors are the biological, physical, or chemical factors. And I have also said that there is a possibility of a combination of these factors to do the pulpitis. And I have said that as an example of this combination of these factors is a tooth fracture, because when there is a fracture in the tooth, there will be a physical trauma, there will be a bacterial or biological trauma subsequently, so that it is a combination of factors that will lead to pulpitis. So that And before I start the presentation, I just want to remind you with the anatomical planes that we have studied in the anatomy. We have three planes: the coronal plane, the sagittal plane, and finally the horizontal or transverse plane. And so that you will not be confused about these planes, because my subsequent explanations will be based on them, I want you to always remember that away from the horizontal or transverse plane, we have the vertical planes, and the vertical planes are two: the coronal plane, like the plane of the crown means coronal, of the Queen Elizabeth crown. So that you need to always remember that the coronal plane is like the crown plane, and the other one, so that obviously, is the sagittal plane. So that according to these planes, we will classify the fracture injuries. And the first one, which is the coronal or sagittal fractures, or the vertical fractures. The second one is the transverse or the oblique fractures, or the horizontal fractures. So that, guys, I want you to know that we have only two types of fractures that happen to the tooth: vertical fractures and horizontal fractures. And each one of them will affect the crown only, or will extend and affect the crown and root, or it will affect the root only. And I also want you to know that the crown fractures, when the fracture is happening in the crown only, it will either affect the enamel only, or the enamel and dentin, or the enamel and dentin and extend to the pulp. Okay, so that I will talk about each one of them separately. Before that, I want you to know that the etiology of all of these factors is a trauma. And as I said, that we are talking about the traumatic injuries of the tooth. And the first part of the traumatic injuries of the tooth is the tooth fractures. And the second part of the traumatic injuries of the tooth is the displacement injuries that I will talk about in another and separate video. So that the etiology, or let's say the past of these fractures, is mostly a trauma. Now let's talk about the vertical fractures, or as we say, the coronal crown plane fractures, or the sagittal fractures. And the first type of the vertical fractures is the crown fractures, which will include the enamel only, enamel and dentin, or enamel and dentin and extend to the pulp, as we have said previously and as we can see in these pictures. So that when we have a vertical fracture, whether it is in the coronal plane or a sagittal plane, that affects the crown only and that affects the enamel of that crown only. Uh, Most of the cases we will have a fracture that is in the sagittal plane. Is it possible to have a vertical fracture of the crown, of the enamel of it, in the coronal plane? Yes, it is possible, but mostly we will have it in the sagittal plane. So that anyways, this fracture is also known as a CRAZE line or infraction. Infraction is the CRAZE line that is specifically caused by a trauma. Okay. This is, how can you see it? These are the signs of it. You will see vertical fractures, or let's call them as cracks or CRAZE lines or infractions in the tooth enamel, as you can see in this picture, in the arrows, the lines that are indicated by the arrows in this picture. Usually there are no symptoms, or if it has just occurred, there might be some reversible pulpitis pain. And when I say reversible pulpitis pain, I mean the pain that is temporary, that subsides after the removal of the stimulus, that is caused by, let's say, thermal changes, hot or cold foods, or any stimulus that is temporary and subsides after the removal of the stimulus. This is the reversible pulpitis pain. The treatment of this type of fracture is no treatment unless for aesthetic concerns. The second type of the fractures, again, if we have a vertical fracture that is present in the crown only and that is present in the enamel and dentin, in this case we will call it as a cracked tooth, or commonly known in the dental community as the cracked tooth syndrome. The cracked tooth syndrome is a syndrome that is composed of three cases. This is the first case, when there is a fracture, a vertical fracture that extends to the dentin and is present in the crown only. The signs and symptoms of this cracked tooth syndrome, as we can see, the signs are a visible fracture that we can see it by inspection or by transillumination, and the symptoms are the reversible pulpitis pain or release or biting. Guys, this is very important and very common in the board exam to ask you what is the symptoms of the cracked tooth syndrome anyways. And there is a possibility of the presence of pockets might be present, and they might be multiple in this case. And the treatment of this cracked tooth is always to collect the cracked tooth parts and support them and splint them by a crown. And if possible, and if it is needing an endodontic treatment, we will do an endodontic treatment. Then we will do a prosthetic crown to support it. Okay, this is the case for any crack in the tooth. So that all cracks or fractures in the cracked tooth syndrome cases will mostly show mostly. Reversible pulpitis pain and periodontitis pain on percussion or on biting and pockets because of that periodontitis. Okay. The second case is when we have a vertical fracture in the crown only, but it extends from the enamel to the dentin and pulp, and as we can see here that there is a blood, so that the pulp is involved. This is the second case of the cracked tooth syndrome cases. The signs and symptoms. The signs, as we can see here, visible crack, very obvious, and the symptoms are reversible pulpitis pain, or pain on release of biting, as I have said previously, and possibly pockets. The treatment again is, if possible, we can do endo and the crown to collect the parts of that fractured tooth, or exo treatment if the crack is very huge, and that will depend on the clinical situation that you are passing through. You will decide if it is savable and needs a prosthetic crown, or it is not savable and needs an exo procedure. Exo means extraction. And the second case, which is when we have a vertical fracture in the coronal or sagittal planes, but that fracture extends to the root. this case, in this case, we will have two situations: the partial crown and root fracture, or the complete crown and root fracture. The partial crown and root fracture is the third type and last type of the cracked tooth syndrome cases. We will have a vertical fracture in the crown and extends in the root, but not to the whole length of the root, because if that happens and a complete crown and root fracture happens, that will be known as a split tooth, and it will not be a cracked tooth syndrome. Okay. The treatment of this case is either exo procedure or a hemisection if it is a lower 6, and so much of the cracked tooth syndrome cases happen in the lower 6s, so that it is possible to do a hemisection or an extraction. Or if it is savable, the tooth, if we have a partial crown and root fracture and the tooth is savable, we can do endo and cover it by a crown. And the last case of the vertical fractures, that is the root fractures, and that happens only in the root. In this case, it is also known as a vertical root fracture. The vertical root fracture signs and symptoms, as we can see here in this picture, we should reflect a flap and either see it by inspection or doing trans-illumination to aid us in the detection of the vertical root fracture. The vertical root fracture, as we said, it might happen in a coronal or a sagittal planes, but mostly in the sagittal planes. And this is the signs of it. The symptoms of it is also reversible pulpitis pain, or a slight pain, or pain on percussion, and most importantly, a J-shaped radiolucency. This thing comes pretty much a lot in the exams, and you should know that the fractures of the tooth that occur in the vertical plane, that occur in the root only, which are called as vertical root fractures, may be mostly associated with a J-shaped radiolucency. The treatment of this thing is extraction. It is always not savable, And save what? The root is fractured. Save what? Do endo for it? Do You can do anything. You either do an amputation if it is a multi-rooted tooth and you have fractured one of the roots, or a hemisection if it is a lower six, amputation if it is an upper six or any upper molar, and if it is a single rooted tooth, it should be extracted.